Okay, we have a pretty fair number of people here, and I'm going to go ahead and start us up on our lab today. And today we're going to take a look at the axial skeleton. Last week we looked at the skull, went through all the bones of the skull. Today's a little bit easier in that the axial skeleton only consists of the bones of the ribs, the sternum, and the vertebrae. So a little more straight, a little bit less to have to try and master at one time. So, and again, as I said before, the way to learn these bones is to do a little bit every day. Don't try and sit down and try and get them all at once. There's just too many bones and too many processes to try and address. So try to do them just a little every day till you have them memorized. That's all it is. It's strict memorization. I recommend anything that helps you, flashcards, because when you write down on a flashcard, you're storing information in part of your brain. If you write down the answer on the back or put a picture in, that's another area you stored it. If you teach it to somebody else, even if you talk to your dog or your cat or your next door neighbor or somebody, if you teach it to them, you store it in an even greater area in your brain. So there's a wide variety of applications that you can use to memorize this. There are a number of examples online that you can use. It's just quiz sheets, where you have the skeleton laid out, but don't have any labels there, and you can quiz yourself. And I'll try to send out some of those for people to look at and try out. But it's really strictly learn it by memory. You've got the list, so you know what to expect. So, okay, let's get into the axial skeleton in here. Of course, I erased it from yesterday. So sharing. And let me go bring it up again. Okay, here we go. Okay, everybody should see the slide. It says the axial skeleton now. Let me go ahead and open it up a little bit more. There we go. Okay, axial skeleton consists of the vertebrae, the ribs, and the sternum. And let's start right here. There's the sternum, often called the breastbone. It has three parts to it, which are called the manubrium, the body of the sternum, and the xiphoid process. That's the little tip at the end. We have the vertebrae. These are the cervical vertebrae. Below the cervical vertebrae, we have the thoracic vertebrae. And then below that, we have the lumbar vertebrae. And we have the lumbar vertebrae, and below those, we have the fused vertebrae, the coccyx, which is the tailbone, and the sacrum. Here are the ribs. There is what is called an intervertebral disc. It is a pad of fibrocartilage that separates the body of each of these vertebrae so the bones don't rub together. We don't like that. We don't like when our bones rub together. It causes friction, it causes pain. So we keep the disc there in place to prevent the friction, also to act as a shock absorber when we move. course, there's one of the lumbar vertebrae. So we have the cervical vertebrae, the thoracic vertebrae, the lumbar vertebrae, the sacrum, and the coccyx with the discs in between. Okay, so here are the ribs. There are 12 pairs of ribs. The first 7 pairs are called the true ribs. They anchor on the vertebrae in the back, and they anchor indirectly to the sternum in the front. They anchor to hyaline cartilage, which anchors to the sternum. The first 7 are true ribs, meaning they anchor directly to the sternum. The next 3 pairs, 8, 9, and 10, are the false ribs, because the false ribs anchor indirectly to the sternum. They anchor, you can see 8, 9, and 10. You see how they come together here? You'll see a better picture when it stops moving. 8, 9, and 10 anchor to the hyaline cartilage of rib number 7. So they anchor indirectly. We call them the false ribs. So 1 through 7 are the true pairs. 8, 9, and 10 are the false ribs. And the ribs 11 and 12 are these ribs down here that don't attach in the front. They only attach in the back on the vertebrae. They don't complete they don't have a complete coverage all the way around. And so we call these the floating ribs. Now in the front, the anterior region, or I guess the ventral, in the ventral side of our bodies, so we have on the ventral surface, we have the sternum. The sternum has 3 parts to it, or 3 regions. This is where the ribs attach either directly or indirectly. So you are ribs 1 through 7, you're attaching directly. You have cartilage. This is hyaline cartilage all along in here. And the pairs 1 through 7 will attach directly to the sternum. 8, 9, and 10 are going to attach indirectly, because they're going to attach to rib number 7's band of cartilage. So here's 1, 2, 3, 4, 5, 6, and 7. Even 7 attaches directly, but then 8, 9, and 10 attach to this cartilage. So we call them the false ribs. And then 11 and 12 don't attach in the front at all. But the parts of the sternum, there is what's known as the manubrium. It's the top region. There's the body. Whenever we have a structure in anatomy that's in the middle of another structure, it's like the middle region of a structure, we tend to call it the body. So that's a term you're going to hear a lot in anatomy, is the body. And then at the very tip is the xiphoid process. The xiphoid process is a pointy end of the sternum. It indicates the location of the diaphragm. The diaphragm is directly below that. The diaphragm separates the thoracic cavity from the abdominal cavity. If you've ever taken a CPR class, you know about the xiphoid process, because the xiphoid process, that's where you don't put your hands when doing compressions. Because if you compress the xiphoid process, you're going to lacerate the liver, which is right underneath it. And that's bad. It's not a good thing to do when you're trying to do CPR on a patient. But anyway, the xiphoid process is a good landmark, because we know where the xiphoid process is. It tells you where the diaphragm is. So it's a good thing to know. Now, the manubrium also has several notches on it. The notch in the middle is called the jugular notch. Now, the jugular arteries that go up to the brain are going to come up behind. I'm sorry, jugular. I got the proper. The jugular veins, which come down from the brain. My brain checked out for a second. Sorry. The jugular veins, which are draining the circulation of the brain, are going to come down through those openings in the skull, the jugular foramens we saw from last week. They're going to come down through those foramens, and they're going to join the great vessels right above the heart behind the jugular notch. So they're going to come down, and the internal versions are going to pass through the jugular foramen, and then they'll join with the eventually end up in the superior vena cava. The blood will eventually end up in the superior vena cava. But we'll talk about blood vessels in AP2. But they pass behind this notch. Now there's another notch that we see here, and that's called the clavicular notch. The clavicular notch is where the clavicle articulates with the sternum. It forms part, it's a joint. It's a joint. You can see it right here. You can see this joint right here where the clavicle joins with the sternum. The clavicle has a thick end and a thin end. The thick end fits into that notch on the clavicle. The thin end of the clavicle, which you see out here, now this is our collarbone, and it's not part of our axial skeleton. It's part of the appendicular skeleton, but this is a good time to talk about it. The flat end of the clavicle articulates with this flat structure of the scapula of our shoulder blade. And out here, the clavicle and the scapula and the head of the humerus all form what we call the pectoral girdle. So we have this notch on each side of the manubrium for the two clavicles, our collarbones, to come together. They're at the top of the sternum. And there's another notch right behind it. You can sort of even feel that one, where the jugular veins run behind the manubrium. So those are the parts of the sternum. Now, if we look at the back side, on the dorsal surface, we see the three sets of vertebrae. We have the cervical vertebrae, we have the thoracic vertebrae, and we have the lumbar vertebrae. And then below that, we have the fused sacrum. That's a structure down here. Right there's the sacrum. It consists of 5 fused vertebrae. And then below that, we have the coccyx, which consists of 3 fused vertebrae, often referred to as the tailbone. So, not unusual for the coccyx to fracture during childbirth. It is sort of out there. It's surrounded by very powerful muscles, and when the expectant mother bears down to deliver, it's not unusual for the tailbone, the coccyx, to fracture. It's not a big deal in the sense that there's nothing, the same bones that cause, same muscles that cause the fracture help hold it in place, but the tailbone can be fractured during delivery. So it happens. Just the pressure of bearing down will cause it to snap. So, or a fall entry. Again, no, it's the kind of injury that okay, you've broken your coccyx in a fall. Okay, it's going to heal up on its own. So these are the vertebrae that make up the spinal column. Now, some are fused and some are individual vertebrae. The ones that are fused, they still have, at least the sacrum still has openings for the passage of spinal nerves to go into and out of the sacrum, just like we'll see up here and all the other vertebrae too. Okay. There's the sacrum. You can see the openings there. Those are called the intervertebral foramens. And we have lots of intervertebral foramens. Those are the foramen between the vertebrae, intervertebral. So we're going to have numerous openings in the sacrum, and then the coccyx is fused out of 3 vertebrae. It has no openings in it. There's the coccyx. You also see that we have the openings for at least 4 with intervertebral foramens in the sacrum here too. Plus, we also see what we call the spinous process. Since this represents 4 or 5 vertebrae that fused, each vertebrae has a process that juts outward in the dorsal direction. We call that the spinous process. Often visible is the edges of the spinous process are visible through the skin in many people on their back. And so what we're seeing here is the remnants of that as these fuse together. But every vertebrae, except for the first 2, is going to have a spinous process. So here we see our vertebrae. Even on our model, the coccyx is missing here. The coccyx, because the model was built to life size, and over the number of years through handling and manipulation, the coccyx disappeared. So we have the 3 sets of vertebrae and sacrum, but no coccyx. Cervical vertebrae, thoracic vertebrae, lumbar vertebrae. And there's the sacrum right there. The sacrum sets in the posterior region of our hip. It forms a joint with the iliac bones to form the sacroiliac joint. And this is a very important location for management of shock. Shock from the motion of walking is transferred up the femurs, through the hip, through the iliac bone, into the sacrum, transferred up the sacrum, so the shock of walking is absorbed by all of the intervertebral pads between the vertebrae, the intervertebral disc, if you will. So it doesn't hurt when we walk or run or climb stairs or anything like that. At least it's not supposed to. Here's the thoracic vertebrae. You know, we have 12 pairs of thoracic vertebrae, 1 for each set of ribs. Ribs attach in the back and also in the front on the sternum. So we have 12 thoracic vertebrae. And I'll tell you that if you're looking at the vertebrae, it's very hard to look at them and identify, say which is which. Lumbar vertebrae and the, like thoracic 11, thoracic 12, and lumbar 1 and 2 look very, very similar. It's very hard to look at it and say which is which. Most of the vertebrae, you're doing good to say, well, that's probably cervical, or if it's separate by itself. If you look at the vertebrae and say, well, that's cervical vertebrae because they're small, that's probably cervical. If they're medium sized, they're probably thoracic, and if they're large, they're likely lumbar. It's just when we're at the edges of the boundaries, it's become somewhat challenging, which is which. There's only 2 very distinctive vertebrae that we have, and that's cervical vertebrae 1 and cervical vertebrae 2. 1 is called the atlas, and 2 is called the axis. The atlas is what we use to hold the skull on top of the spinal column, and 2, the axis, is what we use to allow the skull to rotate around the spinal column. All the other vertebrae tend to have the same structures and look about the same. Differences in size. There are the thoracic vertebrae. There are 12 of those, corresponding to the 12 sets of ribs. Even though the last 2, the 11 and 12 sets, don't articulate in the front, they still articulate on the dorsal surface in the rear. Which there's one of the ribs right there. So there are the thoracic vertebrae. They start right at T1, right where the thoracic cavity starts, and they end right above the lumbar region. And we have 3 to 5 lumbar vertebrae in here. Our spinal cord only goes down as far as lumbar 2 or maybe lumbar 3. We'll talk more about that later, but the spinal cord doesn't go all the way down. It stops somewhere, like I said, between 2 and 3. That's important to us. Now, this is not a fish. You know it looks like a fish, at least if you imagine it. You probably didn't think it looked like a fish till I said it looked like a fish. Anyway, this is the sacrum over here, and this is C1, cervical vertebrae number 1. The axis, the atlas over here, and C2, the axis is right there. Now, these openings you see here are the intervertebral disc, the intervertebral foramens. The intervertebral foramens, the openings between the vertebrae. They only exist because all these vertebrae nest together. And the notch on each vertebrae helps to form this foramen. As they nest together, the vertebrae underneath, like if you have thoracic 1, and then underneath that you have thoracic 2. Well, 2 nests up underneath 1, and the notch on 2 and the notch on 1 come together to form these openings. These openings are not true, canals or channels or holes or anything like that. These foramen, these intervertebral foramen, are simply what gets formed when the vertebrae nest together. So we see all these holes are the intervertebral foramen. These are the passageways for spinal nerves. 31 pairs, I think, 30 some pairs of, and we'll address that in lecture, spinal nerves that feed into and out of the spinal cord. And there are the pairs match. You have a spinal nerve 1 on the left side and spinal nerve 1 on the right side. And each spinal nerve not only is like spinal nerve 1, each one of those on the left and right is going to have both a sensory component bringing information in and a motor component going out. So these spinal nerves are very complicated. They have a sensory and motor going into and coming out of the spinal cord on both sides. So these spinal nerves are paired, working their way down to the end of and below the spinal and at the end of the spinal column. They all go in through these intervertebral foramens here. Of course, there's the intervertebral foramen on the sacrum. The sacrum consists of 5 fused vertebrae, but it maintains these 4 openings here on each side for the passage of the spinal nerves that are going in towards the spinal cord. They have to go in and they have to go up to reach the spinal cord. Sacral promontory, and then the intervertebral foramen. And if we look on the other side of it, we can see what we call the spinous processes. Those are the bulges of the vertebrae. Now, the purpose of the spinous process, the purpose of what are going to call the transverse process, is points of attachment of muscles. Because we have lots of muscles that hang on and they're attached here to our vertebrae. Spinous processes, and of course these are the same intervertebral foramens here. This model is life-size. This is a life-size model of the lumbar vertebrae. I guess it's life-size. I can say it's life-size. Anyway, it's the lumbar vertebrae. The vertebrae are about 1.5 inches across here. This area is called the body of the vertebrae. This wing that sticks straight up and down, is called the spinous process. We get one spinous process which juts out on the dorsal surface, sticks up, sort of like the fin on a shark, And then we have two wings that stick out on the sides. Those are called the transverse processes. So we have the spinous process here and the transverse process on each side. In the middle of that area where we have the transverse processes is the vertebral foramen, where we have the spinal cord located. Let's show you some of the labeling here. Spinous process, the single wing that sticks straight out the back. We can sometimes see the bulge on a person's back as we can see the vertebrae moving down. As we see the bulge at the top of the spinous process. There's one of the transverse processes. They stick out to the sides, they're like wings on the side. There's the body of the vertebrae. It's like we saw the body of the sternum. Now we have the body of the vertebrae. This is solid bone in here. Well, it's not solid per se, but it is not a, there's no opening in this structure. And between the body of all the vertebrae are going to be the intervertebral disc, these big pads of cartilage to function as a shock absorber. That's what we see down here. Here's a pad. And there's the spinal cord in the vertebral foramen running up and down to about 2/3 of the length of the spinal column. It's about as big around as your thumb, leading the skull. It's about as big around as your little finger when it gets down to that level in here. Okay. Intervertebral disc. There's one of the spinal nerves. The spinal nerves are both. They come in on both sides. So each side is going to have a sensory and a motor component contained within that nerve. So you have sensory coming in and motor going out. This is what's known as a rupture or a prolapse or a herniation. When the disc, some people say the disc blew out. And I blew out my back type of phrase. What happens here is when the stresses between the vertebrae become so great through friction or wear and tear or whatever, that the disc can't take the strain anymore, and part of it ruptures and moves out into the spinal cavity itself. It's quite painful for those who've experienced that. It's a painful process and often involves having the vertebrae fused together to treat that, because that's the easiest approach. Because when this is, every motion a person makes with a prolapsed disc is going to be painful, because it's going to allow friction, whether they're turning or standing or sitting or whatever, or walking. The shock of motion is going to trigger pain at the site. Okay, so let's take a closer look at these vertebrae. This is a thoracic vertebrae, and you can see a number, even though we're not looking at it from the side or from the top, and from the top or from a different angle, we can see a lot of structures on here. This is known as the spinous process. There's the body of the vertebrae right there. There's one of the two transverse processes or wings that stick out from the side. There is the single spinous process that projects outward on the dorsal surface. So again, it's this region right here that you may see a slight bulge or a ripple down a person's back as we're seeing the edges of their spinal column there. That is the spinous process. So we've seen the body, the transverse process, and the spinous process. This notch here will form the intervertebral foramen when another vertebrae nests there, and the two notches come together to form that foramen. Because the foramen is a hole. This is not a hole, this is just a notch. But when two notches come together and are held together like that, then we create a passageway for the spinal nerves. This surface here is called the superior articular surface. Anytime you have a superior, you have to have an inferior. You describe a superior surface, you have to have an inferior surface. And that superior surface shows up on every vertebrae, except C1 and C2, shows up on every vertebrae, and it is matched by an inferior process or inferior surface on every other vertebrae. So this vertebrae here with its superior surface right here in front of the transverse process has an inferior articular process or surface there. And so what happens is that the vertebrae in front of this one, you imagine that this vertebrae, let's go back to this picture here. This one. They're the intervertebral foramens right there. This is your spinous process here, and you can sort of see the transverse processes sticking out. There are the intervertebral foramens. Now, if you look at these vertebrae, here is where I have the arrow pointing right now, is the superior articular surface. The superior articular surface is a flat surface that juts upward in this, in the superior direction. That's why we call it the superior articular surface. It juts upward, and it is matched by the inferior articular surface on the adjacent vertebrae. So there's the superior surface there, and then if we look at this vertebrae, there's the superior surface, and there is the inferior surface on the vertebrae in front of it on this one. And the inferior surface comes down on top of the superior surface. The inferior surface sits on top of the superior surface. The inferior surface is pointed down, superior is pointed up. They nest on top of each other. The same thing applies here. Superior surface, inferior surface. Superior surface there pointed up, inferior surface pointed down. When these surfaces come together on the adjacent vertebrae, it forms these openings right here. Back up to the picture. Transverse. So here we are. Body, transverse, spinous. The superior articular surface is matched by the inferior surface of the vertebrae in front of it. That's the superior articular surface. The inferior articular surface of the vertebrae in front of it nests on top here and creates the intervertebral foramen right here. Down here, here is our own inferior surface right there on this vertebrae. And that will sit on top of the superior surface of the vertebrae below it, the next one down. And when they nest together, they will form a foramen here. So we have a foramen here, we have a foramen here, and we have a foramen up and on each side, up and down the line. Because the superior surface supports the inferior surface. Inferior is on top with its surface down on top of the superior surface. Superior surface is on the bottom, holding up the inferior surface. So they nest together. And there is this notch becomes the intervertebral foramen. Now there is a facet for the rib on that side, and there's another facet up there. So we can attach our ribs to the vertebrae. Another illustration here of a thoracic vertebrae. Now we're looking straight into it. There's the body right in the center. there is the vertebral foramen for the passageway of the spinal cord. There's the spinous process. There are the two transverse processes. This flat area here is the superior articular process or surface. Either or, doesn't matter which one. Now, the vertebrae in front of this one would have its inferior surface sitting on top of this one's superior surface. And the combination of the two together create the intervertebral foramen. It's in between the vertebrae. So you don't see a foramen on this vertebrae. You don't see a foramen except for the vertebral foramen. You don't see any other foramens. But when they are in the body, when they are separated by the pads, the cartilage pads, and when they are nested properly on top of each other, then we have the intervertebral foramens present. That's called the lamina, and that's called the pedicle. Now, cervical vertebrae 1 and 2 are a little different than the rest. They're specialized. Cervical vertebrae number 1 is called the atlas. Atlas holds up the skull. The occipital condyles on the base of the skull and the occipital bone. Occipital condyles are on either side of the foramen magnum, the big hole in the base of the skull. Foramen magnum. The occipital condyles are on either side of the foramen magnum, and the occipital condyles, which are nothing more than a process or a bump that goes in the superior inferior direction, up and down. They rest on fossa found on the atlas. So the atlas, cervical vertebrae number 1, holds the skull up. In ancient mythology, Atlas held the world on his shoulders. So I guess when early anatomists were naming bones, they said, well, this holds the skull up. Let's call it Atlas. Cervical vertebrae number 2 is called the axis. The axis allows the skull to rotate around a central structure on the axis, because our head can turn to the left and to the right and bob up and down. This movement occurs around the central structure on C2, on the axis. So here we see them right here. There's C1. There's C2 right there. Now, the atlas, C1, the occipital condyles rest on top of the atlas. C2, called the axis, has a structure that protrudes up in the ventral surface of it, called the dens, or the odontoid process. The dens creates the axis, or an axle, if you will, to allow the skull to rotate. As we look to the left or look to the right, there are very powerful muscles attached to our sternum and our clavicle that attach to our mastoid process. And those muscles pull on the mastoid process and turn our head to the left or to the right. And it is the tension formed on those muscles pulling the mastoid process to the left that causes our head to rotate around the process on the axis. That's the basis of turning our head to the left or to the right. So we have the atlas as cervical vertebrae 1, or just C1. Here is C2, the axis. And here we see, we can visualize C1. Let's say here we can see C1, but there is C1 highlighted in red, and you can see the occipital condyles right in there. There's one right there resting on top of the atlas. Now these structures are a little different in the shape in their shape. They don't have the same transverse process, spinous process, intervertebral foramens that we see on the other vertebrae. They're a little bit different. But there's C1 right there, holding up the skull. There is C2, directly underneath C1, and that red structure sticking out right in the ventral side of C2, coming up behind C1. That's the dens or the odontoid process, and that is what allows that allows the atlas to turn. Yeah, when we pull on the head, the atlas will turn with the skull, and it rotates around C2, this dens or odontoid process right here. So we can look to the left, look to the right, move our head back and forth around this particular process, jutting up here on the axis. This is what the atlas looks like. This is an atlas. See the life-size version of this if you were in lab. But this flat area here and this flat area here are where the occipital condyles are going to sit. There's large processes on either side of the foramen magnum. They sit right here in these two fossa, these two flat areas here and here. And then this opening here is where the odontoid process, the dens, comes up, creates the axle, allows this this structure and the head to pivot around. So there's atlas C1. It does have a, since we have most of our space taken up by the dens coming up through here and the spinal cord, because the spinal cord is pretty big at this point. We also have openings in these modified transverse processes that jut out. So we call it the transverse foramen. And here's C2. This is the axis. There is the dens. And this is the structure supports the atlas. There's a dens right there. It's called the dens or the odontoid process. Dens is easier to remember it. And this is how the skull is held up and how we have the ability to rotate our head around this axis sticking up here. There's a much better view of the odontoid process. Again, this is C2. Again, you see modified transverse processes here and here, and a modified spinous process. But the main thing that C2 does is provides a mechanism for the head to rotate as we turn left to right, left to right, right to left. So, and that is everything on the axial skeleton. So sort of makes up for how long we went last week on the skull. Now, next week, we'll take a look at the appendicular skeleton. And if we have enough time, we'll go ahead and do the joints and articulations with that too. So let me get out of here. Anybody have any questions about this? Now, none of this is on lab test 1. Okay. And unit test 1 only covers chapter 1 and 2. I just want to clarify that point. Nothing on muscle, nothing on the cell or on metabolism is on test 1. Nothing on lab test 1 deals with bones. Bone test is a separate test. We'll get into that later on. So anybody have any questions on anything we've covered? Okay, then I want to get us out of here. And I will see you all next week.